grow uncontrolled, they grow without checking on their numbers, they keep growing. This growth is called cancer. This growth can happen anywhere. It can happen to our organ cells, to our skin cells, to our eye cells, nose cells, mouth cells. If it happens in our mouth, it is called oral cancer. Okay. Now, this oral cancer is one type of cancer happening in head and neck. There are many other cancers also in head and neck, which is growing, happening. So today, sir will tell us about cancer. Anything more detail? What is cancer? Dr. Please.
Okay. Yeah. So that is the question. What is cancer? Dr. Chidi, would you like to do justice to that?
Okay. Once again, I have to apologize. The technical issues are just coming out, in their numbers. Like the good,
still same there.
Okay, so like the good doctor said, cancer is, growth. But the thing about it is it's abnormal growth, So usually the body is capable of, the cells are all capable of growth. They grow in response to stimuli. They grow in response to adaptive necessities. For example, if, somebody is having a lot of workouts at the gym, you notice that their muscles tend to increase in bulk. That's hypertrophy. It means that the cells grow in size. If somebody is having, for example, hormonal stimulation in women, you would notice that they would have hyperplastic growth. Those are normal, and they're kept within the boundaries of reason by the body's physiological control. So the body is capable of growth. We grow to increase in size from infancy to adolescence and to adulthood. But where cancer cells come in is that these growths are unregulated. They have no limits. They don't know where to stop. They don't respect the boundaries.
Yes, sir. You're audible, sir. Please carry on.
Okay, yeah, so abnormal growth beyond the reasons of utility, when the cells just go off on a tangent and just keep growing and growing and growing until they constitute a problem. So that's as much as I could say in such a small sentence for that.
Okay, so there is more about cancer in mouth. Cancer in mouth is more similar, like sir explained. It is common. Any type of cancer which is there in our body can happen in our mouth. More commonly, there is squamous cell cancer, more commonly seen in female reproductive system cancer. It is very, very what should I say? In predation, it is seen in our mouth. Okay, that is oral cancer. This oral cancer can happen any part of our mouth. It can be in our lip, it can be on tongue, it can be on cheek, on gum, or on the floor of the tongue, then borders of the tongue, anywhere. So basic thing to know about oral cancer is that it is caused by tobacco, smoking, hormonal imbalance, poor diet, chemical narcotic abuse. All these things are the major factor causing cancer. This is simple, whatever you are taking inside is going to affect inside. Okay, that will affect first in your mouth because it is going through your mouth. Now, whatever you are putting in your mouth and you're not cleaning your mouth after or before that, that is also an additional factor to cause you cancer. So it's not like that I am prone to cancer, he's not prone to cancer. Anybody is prone to cancer. Everybody is prone to cancer. Everybody is having chances, causes to have cancer. It's our duty to keep screening it, keep checking it, keep taking nutrients to avoid those factors to dominate and cause cancer. Okay. Now, once, every time when you come to my clinic in a dental place, I always ask you, come every 6 months for your scaling and polishing. That 6 months when you're coming to me, I'm not just cleaning your teeth. My dentists are not just cleaning your teeth. We are examining your mouth. Now, why I'm emphasizing on mouth? Because cancer, as Dr. said, it is happening wherever in our body, the manifestations will be seen in oral cavity. So even if you have a cancer in your toe, it will be seen in your mouth. So it will give some picture changes in our mouth, where my role comes, specialists like me, their role comes to examine, alarm you. Okay. Now let's say how does oral cancer look like? Oral cancer can be a growth. Oral, because this is the only place where you can see cancer growing. Anywhere in our body, wherever it is happening, even the skin cancer, you cannot see it growing. You cannot visualize it, but in oral cavity you can visualize it. Now this visual appearance of a cancer in oral cavity can be of two types. One is like a growth, some nodular swelling, tumor like growth happening, or it can be an eroded surface, roughened, scraped, red, white, patchy, these type of surfaces appearing in our mouth. Sometimes sore, mouth sore, oral sores coming on our tongue, on our cheek, on our lip, coming and going, same place again and again, more than 2-3 months. It's an alarm. Go see your doctor first. Go get screened by your dentist, a dentist who can read a cancer. Our general dentists are enough capable of reading it, but if they refer you to a specialist dentist, please go visit them, get examined. So specialists like me can send you to Dr. Chidi type doctors, all those specialist doctors, to start treatment. Okay. So if you have any white patch on your cheek, which you try to scrape with a earbud and it didn't get scraped off, please visit a doctor. If you have habit of biting your cheeks like this, please stop it before it converted into any dangerous level. Just stop it. Come get it checked, how it is, how we can bring it back. There are chances, till these things are visible on your cheek, in your mouth, there are chances by seizing those habits, we can reverse them back. But
Okay.
if these things start stepping more dense, then we have to start treating. And there's a myth
All
that
right.
cancer didn't have any treatment. Cancer have all the treatment, whatever level of treatment is needed. That's
We'll
all
come
about.
back to that, Dr. Ishani.
Sure.
Yeah, so let's just take the question one by one. I can see that you've already more like answered most of the questions I was going to ask you. Yeah, so let me just go to Dr. Chidi from here. So we're talking about cancer grade and stage. So Dr. Chidi, please can you just help us tell us what does cancer grade and stage, what does it mean?
Okay, so when a diagnosis is made by the oral pathologist or the dental surgeons, like the good doctor there,
Okay.
the patient is sent over to the oncologist, who would have to review, evaluate, and plan for treatment of this patient. So one of the first considerations you make before you even have a treatment plan is to find out the grade and the stage, which you've mentioned. So they're two very distinctly different entities, and they're equally crucial in management of the patient. So we'll talk about the grade first of all. So the grade is in layman terms, it means how similar the cancer cell is to the normal cells. So the degree of differentiation, the idea of us as higher animals is that we are capable of differentiating to very special levels, from primordial cells down to cells that are as specific as the neural brain cells. So all the cells are capable of differentiating in higher animals like humans. So it's the degree of differentiation of the cancer cells. And that basically means that it's divided into three categories: well-differentiated cancers, moderately differentiated cancers, and poorly
Okay.
differentiated cancers. It's a whole spectrum. So you start from the well-differentiated cancers all the way down to the poorly differentiated cancers. And that's where you get terminology like low grade, intermediate grade, and high grade. So the high grade cancers are at one end of the spectrum, in that they are so poorly differentiated that they are difficult to manage and they are difficult to control. So that's for grade.
Okay.
Now, stage is what most people are common with, most non-clinical and medical personnel. Everybody wants to know the stage. The first thing they ask you, what stage is it? So stage is a bit different depending on the organ site you're treating. The way a lymphoma is staged is different from the way you stage a tumor in the oral cavity. But since we're staying in the oral cavity here, the stage means a couple of things. The size of the tumor, how big is it? It will come into play when you're planning the treatment. Now, has the tumor spread from the local site to another site? Thirdly, has the tumor affected the lymph nodes in and around the head and neck region? So it's just like merging these three things together and coming up with terms like stage 1, stage 2, stage 3, and stage 4. So stage 1 generally is small tumors, haven't spread distant, haven't spread regionally. Stage 2 is bigger than stage 1, haven't spread to the lymph nodes and haven't spread distant, but they are bigger than stage 1s. So stage 3s are the ones that have spread to the lymph nodes. So lymph nodes are like kind of like bus stops. If you want to go to somewhere, if you want to go to Ikorodu, you go to the bus stop in Jibowu to get a bus, right? So they are like bus stops. They tell you that cancers are about to go to distant places. So it's very crucial that you know what the lymph nodes are saying, especially in head and neck cancers like oral cavity cancers. So stage 4s now are the ones that have left the distant sites, they've left the bus stop, they've gotten to their final destination, and they're settling in just fine. So it now lets you plan your treatment for these patients. And very quickly, before I get off from this grade and stage issue, staging helps you to prognosticate. You can tell with the stage of a cancer how well the patient is going to do, how long they could possibly live, and what you need to do and not do. So in that way, you don't waste resources, you don't overtreat, and you can keep your patient and their family informed of their expectations. So grade and stage, when the clinician brings them together, they're able to determine the type of treatment, they're able to determine the prognosis of the disease, and they're able to determine how well this disease is going to respond to treatment. So while there's a difference, you basically use both of them in drafting out your treatment plans.
Thank you very much. That's well as in self-explanatory. I think I'm able to like get the difference between grade and stage from what you've said. Thank you so much, Doctor. And I believe our audience, they're also picking one or two things from what you're saying already. So I'll just go back to Dr. Ishani briefly, like talking about the symptoms of oral cancer, like what are these symptoms you see when somebody has oral cancer, and how do you typically diagnose them, like in just a few words?
Do not have cancer, do not have any symptoms. It totally has symptomless. The only
Dr. Shani, we can barely hear you.
Yeah, barely.
now.
In fact, we can't get your message there. Like it's faint, kind of. No, nothing is coming out.
Okay.
Okay, so let me go back to why Dr. Shani finds a safe place. Let me go back to Dr. Chidi. So we're talking about cancer treatment. Like a lot of people want to know how does this treatment work. You understand? After we've diagnosed, we've known what grade or stage. So how do the treatment work? And in Nigeria, should we say it's pricey, or it is something that can be affordable regardless of your class?
Okay, so when you're talking about treatment, you have to, like we said just a few moments ago, we have to determine what stage this patient is at and what they actually are going to benefit from. So for example, you have somebody referred to you from the dental surgeon for a small lesion in their mouth. And the thing I don't want to venture into oral pathology territory here, but I just want to talk about the importance of the locations of the tumors, because there are so many places the oral cavities, it might look small, but in terms of clinical distinction, it's really large. So if you have a tumor that is somewhere in the retromolar trigone, we're talking about way in the back of your mouth, in a very small crevice, it might be difficult to even notice. as against the one you have on your tongue, where you can see it when you're brushing your teeth. So when you have tumors like that, they usually tend to present when you have stuff like trismus or issues with the jaw. So you don't tend to find those ones very early. However, irrespective of where the locations are, when you determine the stage, for example, a stage 3 cancer, which is a cancer that is locally advanced, you have some lumps in the neck, you have some lumps in some other areas of interest. You now have to determine what treatment will this person benefit from. And you have to do that as quickly as possible, because you don't want to leave the family in so much suspense and anxiety. Because anxiety is a huge contributory factor to the patients and their relatives alike. You have to determine what you're doing as quickly as possible. So you work them up, you do the relevant imagings, and you confirm the pathological diagnosis, you do your other pathological studies. So you want to ensure that, because it's in the head and neck area, you don't want to give them treatment-related toxicities. I mean, everybody can see their face. You don't want people to ask them, oh, what's going on with you? Why do you have such a huge hole in your face? Why is your face black? So you want to ensure that the tumor is as small as possible when you're sending it back to the surgeon for excision. You want to downstage the tumor. That's what it basically means. So whether you're using surgery or radiotherapy, depending on the accessibility of the area, the goal is to reduce the tumor, reduce the nodes in the neck, control the spread, and excise it. So typically for that, in a country like Nigeria, where a lot of the population don't have accessible health insurance, I mean, even those that have health insurance, the health insurance stops at the very basic stuff. I'm sure you know what I mean. It has to take into cognizance several modalities of treatment. It's not cheap, because you need more than one or two specialists. A radiation oncologist can't work without the oral pathologist. You can't work without the dental surgeons. And in some cases, you need the OMFS, that's oral maxillofacial surgeon. You need everybody's input. So imagine bringing all these people together at the cost of one person's bill. So that's a lot of money. You have the surgeons coming, you have the radiologists, you have the psychologists, the oncology nurses. So it costs a pretty penny to get diagnosed early and treated early, because it's all about getting treated early before the disease has metastasized.
Okay, thank you so much, doctor. I really like the way you responded to that question. Thank you very much, sir. Okay, so I go back to Dr. Shani. Dr. Shani, can we like get a response to that question now? Like talking about yeah.
Like, am I audible now? I hope I am.
Yeah.
So
Yes.
cancer is a symptomless disease. You do not see or feel any symptoms. Like, you have jaundice, you will start having fever, your skin some pain. It didn't happen like that. In malaria, you had headache and all. Cancer do not show these type of symptoms. But in oral cancer, you can see some significations. Like I told you, patches, white patch, red patch, wrinkles, cheeks, shrinkage or overgrowth of gums, all those things you can see. So these symptoms, whenever you see, don't bite your tongue again. If your teeth bite your tongue again and again, please see your dentist. Dentist will smoothen up the tooth or do some habit breaking things to you, so that can treat. Now, if another thing, if these symptoms which you brought, and a dentist or any surgeon confirming might be a cancer, or it has a doubt on it, then they will set for diagnosis. Now, these diagnoses, nobody can do it. One examination that I test your BP, I put a vitality machine, and you have a high blood pressure issue. It cannot be done like that. We have to take some samples. These samples might be just a scrape. We will use simple scraping things, like with COVID-19, we all got those tests done. That sort of or some fluid from that or some might to cut and collect also. Now, these things, they got diagnosed under different microscopes, different pathology works on it. They know what type of systemic it is, what type of, because that is difficult to know. So we can from where cancer is coming? Is it originating from him being migrated from somewhere? All those are are, are it starts the procedure of treatment. Till then, patient has to have psychological, a support. So if your family knows that,
Dr. Ishani, you're breaking.
am I audible now?
Yeah, I think it's better. Just move closer to your phone.
Okay, definitely. Sure.
Please.
So if any of your family member is being under examination of cancer, don't just think that it is a cancer. It might be a healthy skin, just a growth. It might be very simple growth that gets excised and removed, and it might be a cancer. If it is a cancer, and we are examining it, it will help you to treatment. Cancer has 100% treatment. Okay, it depends on patient's condition. As sir told, stages. It all depends on stages. The prognosis is dependent on the stages. Otherwise, treatment are 100% stable. There are 3 stages of treatment: chemo, radio, surgery, whatever is needed. Even plastic surgeries are being conducted for cancer. So it's not a scary thing. It's a smart thing to be aware about.
Thank you, Dr. Ishani. Okay, so I'll go back to Dr. Chidi now. Like, I think this is like the penultimate question for you. So, how long does cancer treatment last? Like, and then do we have any side effect to this treatment? Like, if anybody is undergoing treatment, how long does it last? And are there any side effects? Are there any like post effect that somebody should need to look out for or be prepared for? Dr. Chidi.
Okay, so just like I said earlier, you can't talk about treatment without talking about your goals for treatment. You have to talk about what your goals are, and you have to identify what your goals are. So you're not all over the place when you're treating the patient and you exhaust everybody with your endless treatment. So we call that treating them to death. So you don't want to treat them to death. You want to identify goals. So for example, if you're treating an early cancer, you're going to be very radical about it, meaning that you are attempting to cure the patient. So people really are very cautious when using the word cure in cancers, and understandably so, because you can say you're trying to cure somebody who has a distant disease, and you're not being fair to them to use the word cure. So when you use the word cure, you're talking about diseases that can actually be completely eliminated. And those are the early stage diseases. So if someone walks into your clinic and you've identified a small tumor, let me not say the tongue because that sounds a bit easy. You identified a small tumor in the floor of the mouth. So if we're talking about the floor of the mouth, if you raise up the tongue, that really soft area there is the floor of your mouth. So if you identified a tumor in the floor of your mouth and you want to treat this patient, so you have to plan, first of all, get everybody on board. It's usually best done in multidisciplinary fashion, like we mentioned. Get all the inputs you can get within a week. You should have the diagnostic processes done in a week. Your treatment plan comes out. Okay, you want to do radiation for this person. You want to do radiation therapy for the patient, and they have access to the facilities, of course, in Nigeria, and they can pay for it. So typically, they start radiation therapy if the tumor is not so big and you don't need to downsize it like we talked about with chemotherapy. You go ahead and plan the radiation therapy about 6 to 7 weeks, Mondays to Fridays. They get hyperfractionated therapy. 6 to 7 weeks, they're done. And that is that for that particular stage of cancer. So if it's a more advanced disease here, at this point, you don't really know what you're getting with locally advanced diseases, because that's when you bring in the phrase response to treatment. Everything now is dependent on the response to the induction treatment you're going to give the patient. So you could give induction treatment, the literature says, for about 2 to 3 cycles, see how well the cancer shrinks. If it shrinks very well, good. If it doesn't shrink well, then you have to revert to some other form of therapy that can help with that. So typically, in a stage 3 disease, you could add about 5 more weeks to those initial 7 weeks I told you about. So that would bring it to about 12 weeks. Then in terms of toxicities, we know that the head and neck is a very crucial part of our body. You breathe from there, you eat from there, and you show up with your face. I mean, apart from the times we had masks, everybody has to show up with their faces. So you're very wary about side effects. However, most of the side effects have been kind of minimalized in terms of the latest techniques that are available now with radiotherapy. This isn't 2016 anymore, where we had just basically two-dimension radiotherapy. Now there are a lot more techniques that are available for you to treat people with minimal side effects and maximum damage to the tumor itself.
Damage.
So, but you will still have some side effects. I mean, it's the mouth. You can't get away with it because the mouth, the lining of the mouth is very sensitive. If you put your finger in the lining of your mouth, you can see it's mainly mucous membranes, and they're very reactive to any sort of stress. Just try taking an overdose of vitamin C and you see what happens. Sometimes you can have some ulcers in your mouth. So imagine giving radiotherapy for 7 weeks to that area. You can have dryness of the mouth, which is usually the prelude to ulcers in the mouth. So the irony is you're trying to treat an ulcer in the mouth, but you have side effects of ulcers in your mouth. But those are manageable, and you can give some mitigating agents to help reduce them. Then you can have difficulty swallowing. The throat alimentation becomes difficult. The patient can't eat very much anymore, and you have to take care of that. If not, you see your patient actually losing weight right before your eyes. I mean, usually we see people lose weight. After a while, you see them 3 months later and you're like, oh, you lost weight. But in this situation, because the patient sees you every week, you literally see them losing weight in front of your eyes, and it reduces their fitness. And most of them don't even want to go through the treatment because they're not feeling very good. So you have to make provisions to work against that difficulty swallowing. If it's a very big tumor, sometimes you might need a bypass. It has a bit of morbidity attached to it, but you might need a bypass for that. But in most cases, with proper planning, with advanced techniques, you wouldn't need a bypass. You just plan the patient very well and make sure they're well hydrated, make sure that they are getting supplemental food, like all these nutrient formulations to help with the little that they can eat, because they have a lot of challenges eating at that point. Then you talk about the longer term side effects. I just talked about the short-term side effects you start to see in a couple of weeks. Longer-term side effects that the patient might have is moderate to medium to long-term side effects. There might be a darkening of the area. So what we do sometimes is that you try to spare the skin of the area, especially when the tumor is not close to the skin. You try and spare the skin, but sometimes you can't spare the skin because the tumor might just be lying under the skin. So it's something that we have to just take on board. Darkness of the area, but it lightens up in a couple of months. Then you have a bit of joint stiffness, which can be managed. So basically, with proper planning, you reduce toxicities and you increase the benefit to the patients. Yeah.
Thank you, doctor. Thank you. Thank you very much. Okay, so just a quick one before we go to the last question. Okay, our audience, if you have any question, I believe you can send in your questions. We'll grab them as well. And if you can't answer them on this live feed, I'm sure you have the access of reaching our doctors, even through our channels. You can send us DM. Or also, we have on the 14th of this week, like 14th of April, we're having our oral health awareness walk. And we're working from Beacon Hill down to Lakeshore Cancer Center, where we'll be creating awareness and also doing free check for people out there. So if you can, for more information, you can check our pages for these details as well. So talking about Dr. Ishani, yeah, oral sex, tobacco, smoking, and alcohol in relation to oral cancer. Can you just
chemical exposures, poor nutrition, poor hygiene, that's also.
Okay, so this can definitely lead to cancer, oral cancer. Dr. Chidi, are you giving a yes on that?
I'm not sure she heard you. You need to take that again. I'm not sure she heard
you. Okay. So let me take the question again. Oral sex, alcohol, and tobacco smoking, like in relation to oral cancer. Can you just tell us a little about that?
Okay. So when you smoke tobacco, the tobacco is directly absorbed by our skin, and skin started damaging. Our cheek skin started damaging. When it started repairing back, and again that trauma is happening, it leads to cancer. Now you are taking alcohol also with this. Now alcohol is again increasing this effect, this delaying this healing and causing multiple outer layer of the skin in your cheek. So that is also increasing it. Then oral cancer, that causes hygienic issues, HPV. There's a virus, HPV virus, which causes cancer. So that is also a main, what should I say, root or communication part for it. So all those things are really cause or aggravating factors for cancer.
Thank you. Dr. Chidi, do you want to add more on that?
Sorry?
She said it all, she said it all. The risk factors, every couple of years, new literature comes out to identify something new that has been found to contribute to oral cancer. So the human papillomavirus, sexually transmitted, crucial in a lot of head and neck cancers, although its effect in oral cancers is not as pronounced as in the pharynx or other areas. But there have been some studies to show that it has some impact in cancers of the mouth. But smoking, alcohol, and they have a synergistic effect when you smoke and you drink. So you tend to have a higher risk of coming down with these cancers. So those are the main risk factors that have been identified. Then, of course, like she said earlier at the very beginning, there's some pre-malignant lesions, which this is the territory of the dental surgeons, of course. There's some pre-malignant lesions, like those leukoplakic lesions, those white lesions that can be scraped off. So you have to go see your dental surgeon when you have those lesions that you can't scrape off with a spatula or something on the side of your inner cheek. So when they're not being scraped off easily, you don't just rule them out and say, oh, I'll just go ahead and continue living. No, you have to be seen by a dental surgeon because it's a pre-malignant lesion. Pre-malignant means that if you ignore it, it will develop into a cancer. So precursor lesions are very important, as well as smoking, alcohol, and human papillomavirus.
All right. Thank you. Thank you very much. So finally, I will just ask the question because of our time. I think we really started behind schedule and we really spent more time. So cancer research in Nigeria, would we say it's making an impactful difference? Like cancer research in Nigeria? Yeah. Dr. Ishani, over to you first.
So I think researches are obviously they are going on, but I think everybody should, each and every professional and a patient and everybody should lead into this research. Like how many patients each dentist is seeing every day, and how many of the patients they might see those potentially lesions, potentially malignant lesions, they were there. Those data should be preserved for better results. Like there are many oral cancers. There are some type of bone oral cancers. Those are developmental. They do not happen now. They were there since the birth, and they are predominating in black women, not just African or Nigerian women, any black women. It is predominating. So all those data, all those researches are dependent on inputs, what input we are putting. Yes, very advanced researches are going on in Nigeria. We should not ignore that. Yes, Nigeria is a developing country, so it's not as good as developed countries, but I think everybody is doing research at their levels.
All right. Thank you, Dr. Shani. So, Dr. Chidi, just a bit from you for as regard that question. Do you think oral cancer, cancer research generally, is making any impact in Nigeria?
It's not fair for you to ask me that question. I can't get away with a proper answer when you ask me that question. But I mean, you know what I want to say already, because you're talking about research when I just told you a few sentences ago that a very, very sparse number of the population actually have health insurance.
Yeah.
What are you researching when these people actually can't even go through with their treatments? But yeah, for research, a couple of our colleagues are doing excellent work in research. For example, we've had to rely on data that has been drawn from populations that are not representative of us, not representative of our race or our ethnicity. We had to rely on data drawn from African Americans. So there haven't been enough studies, in as much as a lot of effort is being made, but trust me, it's really, really hard to get quality research out without the kind of grants that you get in other countries. You have to worry about a lot of things before you worry about research, but a lot of research is going on now, and we could do with a lot more input by the government. We need grants. If you go abroad, you see you see the structure of their grants, and you'll be impressed.
Yeah.
You have the NIH bodies that give grants. You have so many bodies giving grants. But when you come to Nigeria here, what are you really getting in terms of?
It's worrisome, actually. It is. Dr. Chidi. Dr. Chidi, are you there? We can't hear you anymore. Oh, okay. I think we lost him there, the network. Okay, so I want to appreciate our speakers, Dr. Ishani, oral maxillofacial and pathologist for Beacon Hill Smile Group. Thank you very much for your time all the way in India. I know the time difference and your activities out there, but we just had to squeeze the space to ensure that we have you. And also Dr. Chidi from Lakeshore Cancer Center. I want to appreciate your time as well. So we'll be having a lot of activities during the week. Tomorrow we're having a virtual session with one of our partners, that's Ikoyi Club. And on, I think, yes, Friday, yes, 14th of April, we'll be having the awareness walk starting from 7 a.m. You can join us at 4 Adela Deku here. If you're in Lagos, yeah, I believe you can be part of it. We walk all the way down to Lakeshore Cancer Center, who happens to be one of our partners, or like the main partner for this event, 14th Amodu Tijani Close. That's where we'll be ending the walk. So the walk will be through Akandishola all the way to Amadu Bello way, Akandishola, all the way to Lakeshore Cancer Center. We'll be seated and have the free check for every individual that comes in that day. There's a free party for all of us. So just try and be there. And it's going to be a wonderful session. Dr. Chidi, I know we lost you there, but I think because of our time, if we have more questions, we can always answer them through our pages. So you can, if you're not following us, Beacon Hill Clinic, you can follow us, and then LCC Cares, that's for Lakeshore. And we want to appreciate all our partners. We've started the program. Yes, we started the program today. Lakeshore Cancer Center, thank you very much. We also have our partners, Leadway HMO. They've given us some goodies, and I think they are also trying to create awareness about this cancer that we're talking about. The Bodyline Fitness and Gym, we want to appreciate you as well for partnering with us. Ikoyi Club, one of the foremost clubs, in fact, the biggest to say. The biggest club around there that you can find, Ikoyi Club. Yes, we've been there. And also want to appreciate Colgate Toothpaste for partnering with us on this, and also all the staff of Beacon Hill Smile Group, all the staff of Lakeshore Cancer Center. Thank you very much, and I will see you during the week, and especially on Friday. I look forward to seeing all the beautiful faces while we do this together. So thank you very much. Go to our page, check them out. Dr. Chidi, thank you very much. I really appreciate your time. Yeah, thank you so much. Dr. Ishani, have a good time out there. And to all our followers, thank you and have a good day.
Bye-bye. Bye, everybody. See you soon on the walk.